If you're turning 65, one thing is for certain. You're being bombarded in the mail or receiving phone calls with information about Medicare. If you're like most, you're sitting there saying, what the heck is going on? Hi, this is Dale Stringer with First Medicare Advisors. This video hopefully will help you decide what is the best plan for you. To keep this simple, in my mind, you have three choices. Choice number one is go with the original Medicare. Choice number two is a Medicare Supplement plan. And choice number three is the Medicare Advantage Plan. Let's talk about choice number one. Now, you can choose to go with just Part A and Part B and Part D prescription drug plan and not pay for either a Medicare Supplement or a Medicare Advantage plan. But by doing so, you expose yourself to some heavy expenses. Without a supplement or Medicare Advantage, you not only have to pay the Part A deductible of $1,280 the first day you're hospitalized, you also have your co-pays while you're in the hospital. You also have to pay the Part B deductible of $166 plus 20% of all charges for Part B services. I like to tell my clients 20% of $100,000 is $20,000, and that's easy to remember. By getting either a Medicare Supplement or a Medicare Advantage plan, you give yourself a safety net. For example, my father-in-law had back surgery a few years back. The hospital bill alone was over $45,000. His cost on his Plan F was zero. His Medicare Supplement plan paid it all. So not going with anything other than Parts A, B, and D is not a wise decision. So which way should you go? Well, choice two, in most cases, is the Medicare Supplement route is the best way to go. The two primary reasons: it helps you stay within your budget better and normally costs much less than your other choices. When you have a Plan F or Plan G Medicare Supplement plan, which are the two most popular plans, these plans are exactly the same benefits except you pay a $166 Plan G deductible. For Plan F, you pay the premium and that is it. Everything else is paid 100%. For Plan G, you pay the monthly premium and you also pay the $166 deductible for Part B expenses. After that, everything else is covered 100%. Now, because of the deductible in Plan G, your premiums typically run 10 to about 20% less. For one of these plans, you can expect to pay approximately $125 to $130 per month at the time of this recording. Of course, that depends on your age, your zip code, tobacco usage, and which company you go with. Now, everyone is going to pay the Part B premium, which is approximately $104 for most people today, no matter whether you get a Medicare Supplement, a Medicare Advantage plan, or just stay on standard Medicare. Now, those getting a Medicare Supplement plan have to also factor in cost of a Part D prescription drug plan. Premiums for the Part D plan range typically from $20 to $25 to over $100 per month, depending upon your particular requirements. You'll also have co-pays on your drugs. Now, even if you don't need any prescription drugs at the present time, it's best to go ahead and get it to avoid the late enrollment penalties. Now, these mandatory penalties for not having a plan could get to be very expensive when the time comes and you need to enroll in a prescription drug plan. So, why go with a Medicare Supplement plan when a Medicare Advantage plan costs much less in premium? Very simply, co-pays, and you must stay in your local network. With Medicare Advantage, you can expect to pay a ton of co-pays, and you could have an out-of-pocket expense that could easily reach $6,700 per year. That is, if you get sick or injured. In short, Medicare Advantage works for those people who don't need to see the doctor very much. However, they can get to be very expensive if you happen to go into the hospital. Medicare Advantage plans generally charge $250 co-pays per day for each day of the first 6 days. In addition, you're no longer on Medicare. You're now with a private insurance carrier, and the carrier determines what gets paid, not Medicare. Typically, what happens is someone will try to get back on the original Medicare after they discover the expenses of the Medicare Advantage Plan, and it becomes very difficult. The Medicare Supplement carriers will ask health questions, and you may or may not be able to qualify for coverage. Now, you can buy a Medicare Supplement plan that will pay all of your hospital expenses and have it cost less per year than you would have to pay for just 1 or 2 days in the hospital. Now, if you're trying to figure out the best way to go for you, give us a call first. We can advise you on the 5 most important pros and cons of each plan. We do that free of charge. And we can also give you a choice of different top-rated Medicare insurance carriers. We can also help you cancel your existing insurance and help you get set up for the Part D prescription drug plan. Now, with healthcare coverage being the number one financial concern of most Americans, receiving your benefits on time and in the proper amount is extremely important. Now, if we can be of assistance to you in this area, do not hesitate to contact us, especially if you have additional questions. Now, you can call us at 1-800-825-2919, or you can email us at info@firstmedicareadvisors.com. Or if you'd like, for a complimentary, no obligation Medicare Supplement Plan quote, go to firstmedicareadvisors.com/quote. And also, you can get a ton of additional information at our website, which is firstmedicareadvisors.com. Now, I would suggest that you pause the video right now and jot down our contact information. It's also available in the description box right below the video. Now, thank you for your courtesy and consideration by viewing our presentation. It's greatly appreciated, and we want to thank you.